Hi, everybody. It's Rachel. I had a few comments this week asking if we could do a little bit of a refresher on what fluids were what, the tonicity of fluids, what it means to give fluids and what they're doing cellularly. So I put together a very short PowerPoint. This is only 4 slides, just as a refresher of the tonicity of fluids. Okay, so the 3 tonicities of fluids are hypertonic, hypotonic, and isotonic. Okay. Now with hypertonic solutions, we have more solutes in the fluid than we do within the cell. Okay. And that is going to, the solutes draw water. Okay. So the water from the cell is going to be pulled in to the outside of the cell. So if water is leaving the cell, it's going to dehydrate that cell, shrink it down. So hypertonic is in reference to the solution outside of the cell. Hypotonic is just the opposite. So hypotonic solutions are going to have less solutes than the cell themselves. Because the cells have more solutes, they're going to draw that fluid in because the solutes attract. So they're going to draw that water into the cell. What's going to happen to that cell? It's going to get bigger, bigger, bigger. It's going to rehydrate it. But if left too long or given to the wrong person, it could actually burst that cell, causing a lot of problems. The one that is closest to our own serum, our own blood, would be isotonic solutions. And so these can gently rehydrate the body, but they are just about the same amount of solutes or solutions outside in the fluid as what's within our cell itself. So if you are following my page, Rachel RN, on Facebook, you've noticed that this morning I decided to do a little experiment with tonicity of fluids, and I got some raisins, and I dropped 3 raisins in 3 different solutions, a hypotonic, a isotonic, and a hypertonic solution. And the experiment worked really well, demonstrating what happens to cells happened to my raisins. And I put a control raisin there for you guys so that you can see that. So hypertonic solutions, again, there's more solutes in that solution, and solutes are going to draw, okay? They attract. So it pulls the water outside of that cell. And you can see here with my hypertonic solution that it drew any fluid that was left in a raisin, which is already pretty dehydrated. It pulled it out even more, so that the hypertonic raisin is even smaller than the dehydrated control raisin here. Okay, so it really shrunk it. So you might be asking yourself, why in the world in clinical practice, using your clinical judgment, would anyone ever want to dehydrate a cell? So let's think about some conditions where a patient could be in a state where their cells are too big. A lot of times these could be electrolyte abnormalities, electrolyte imbalances, where too much stuff has gone into the cells, and we're going to gently pull it out. Or it could be a neurovascular emergency. So with brain injuries, what we see is the cells within the brain swell, causing a lot of pressure within the brain, increased intracranial pressure. So high salt solutions, including 3% and 5% normal saline, might be used. So these are, if you think about it, normal saline is 0.9%. So these are a lot saltier than what our own body is. So with all that extra solute, it's going to suck fluid from the brain, shrinking those cells, decreasing the intracranial pressure. So 3% normal saline and 5% normal saline would only be used in instances where a patient is very closely monitored, and they're going to be in an intensive care unit. We're not just going to give these on medical surgical units. D10W is also a hypertonic solution. D5 normal saline is hypertonic. D5.5 normal saline is hypertonic. And D5 Ringer's lactate, we call it D5LR, is hypertonic. Now, Ringer's lactate is a little bit different than normal saline in that it has some extra electrolytes in them. It's going to help to balance acidosis in patients. It is on its own isotonic solution, but when you add dextrose to it, it becomes hypertonic. Dr. Ringer is the one who invented, or not invent, yeah, I suppose he did. He invented this serum. In this area of the country, we often refer to it as lactated ringers, but it's probably most appropriate name would be Ringer's lactate. So in the presence of hypertonic solution, you can see what happened to those cells. They shrink. So again, electrolyte abnormalities and brain injuries are probably going to be the most common times that we use these solutions. Hypotonic are going to rehydrate the cell. So these have less stuff in them than what's in our normal blood, and what's in the cell. So it's going to rush fluid into the cell. Water is going to be able to enter it. So this is going to help to rehydrate the cells. Half normal saline, a third normal saline, and a quarter normal saline are all fluids that could be used. What would be dangerous about this? Again, you're thinking about your brain. Fluid isn't just contained to one part of our body. It's affecting all the cells. So it could make those cells in your brain get too big and even burst. So this raisin was left in the solution for about 8 hours while I went to work today. And you can see how much fluid it pulled in during that time compared to the control. Okay, so you had a lot of hydration going on. Again, if it's too much, if a patient doesn't need all that fluid, that cell is going to continue to grow and it will actually even burst. Isotonic solutions are the solutions that are like our body. This would be normal saline, 0.5% sodium chloride is normal saline, or Ringer's lactate, which is, again, very similar to how our body's concentration is, but it does have some extra electrolytes in there, and it will battle acidosis. If it's a long-term therapy, we're going to be giving it for a few days. Ringer's lactate will tend to push patients into alkalosis because it has that tendency. It's just how it works. So you can see that the isotonic grape isn't all that different than the control grape. It sat in some water today, but it was very similar to the size of the control grape. All right, so that was a quick and simple tonicity of fluids. If you guys have any further questions, please let me know. I'm here to try to help you as much as I can. Thank you guys, and I hope you have a great day.